All right, have some really important information for you if you are a caregiver of a family member suffering with dementia. This is really important. I want to share with you some information about no cost support for caregivers of those suffering with dementia. This is a new program that just rolled out. To talk about it is Michelle Rankine. She is the owner of Right at Home in Louisville. And Michelle, tell us about this program called GUIDE, which is an acronym for what?
It's an acronym for Guiding Through an Improved Dementia Experience. And so the GUIDE program is to help not only the patient who has dementia, but also for the caregiver.
How does it work,
So
Michelle?
there's an eligibility to be part of it, and you'd actually have to have traditional Medicare Part A and B. Unfortunately, Medicare Advantage programs do not qualify, as well as those that have a diagnosis of dementia, or if you have a loved one that has the symptoms of dementia and doesn't have the diagnosis, that process we can assist with.
Okay, and let's talk about the type of undergirding for these caregivers that is offered through the GUIDE model.
Yeah, some of the great benefits that they get is that they're going to receive respite hours. Many people don't know the word respite, but in big terms, it just means a break. And for those who are caregiving for a loved one with dementia, it really takes a toll. And so it's really important for persons to know that they're going to have this extra support with a break. In addition to that, they also get access to 24/7 geriatric case manager that can help them with medication management or teaching them possibly the skills of how to train a caregiver. Many of us who are caring for their loved ones, we're not trained and we really don't know the best practices. And they're going to have that at 2 a.m., 3 a.m., anytime they want to pick up the phone and call once they're eligible through this process. And I think the final benefit is that this is a test model through Medicare, and it's for the next 7 years. So they have the eligibility for this program for the next 7 years.
Okay, and you are one of the first, I believe, if I'm understanding correctly, in the country to roll this out in a pilot?
Yes, sir. Right at home, we started that pre-pilot last year. So it officially launched just July 1st nationwide. But through our guide participating agency, we were able to be on the front line and doing this a year early, which we have seen a reduction in hospitalizations by 30%. And we
And
have
those patients you're working with.
yeah, as well as we've seen just, the humanization of that. Now people had an extra benefit where they didn't have to drive from Flower Mound to Plano to visit their loved one every day or in fear that something was happening because they had a caregiver there. And, there's just so much that we can do. And I think the biggest thing that I think to be proactive is see if you're eligible so you can get this benefit before burnout because
Um,
caregiver burnout is something real.
what areas do you service in North Texas?
So right at home, we service the whole Metroplex. I'm one of 10 owners. And so I own the territory that covers Collin County, Denton County, a little bit of Tarrant County and Dallas County, but all of our owners can cover the whole entire Metroplex.
Okay, and your staff, if that's the right word,
Yes.
is large enough, expansive enough to handle uh, surely the number of inquiries that'll be coming after this airs.
Yeah, I know just for our Metroplex, we did the numbers. We have over 855 qualified caregivers within the Metroplex to service, and we're still growing.
Okay, so now here's the important part of this conversation. How can folks reach out and start this qualification process, and how long does that take?
Yeah, I'm so happy you asked that. So I know many people have this microwave thing like, hey, call, you're going to get it instantly. Unfortunately, it does take a little bit of time. So I would say between 30 to 45 days because the process begins with an initial welcome call, and then we actually have to do an assessment through CMS and then get their approval. And right now it's around 30 to 45 days until they're approved, and then they have it, and then they have to go through an authorization every year.
Okay, and how do folks connect with you?
And how they connect with us is they can go to our website, rightathome.net, TX Metroplex, and you will find all of our landing page for all of our owners in the DFW area. Or you can just simply just give us a call at 1-800-490-9721.
Okay, and I don't want to gloss over this part. I want to go back to it for a moment.
Mhm.
If I'm accepted into the program, my family, as a caregiver, um, then this is like a research program. And so for 7 years, I am part of this program, but I have to reapply or be reapproved each year.
You have to do a reassessment.
Okay, to see what, Michelle, in that point?
Part of the reassessment is just to see how you the caregiver has benefited through the program. So it's a touch point to actually just see how the process is going, the medications, and just to check in. It's part of the process through CMS that every year you have to do another reassessment. Because why? Can I start that over? I know you're recording.
Yes, please.
One of the key factors is that when they're doing the eligibility process,
Mhm.
persons may qualify for the 24/7 support without the respite because they might not have reached moderate to severe dementia. So you may have just memory loss. You would qualify for the 24/7 support, but you wouldn't qualify for the respite. You actually have to have mild to moderate dementia symptoms to actually qualify for that. So that's also part of that reassessment process to see if there's added benefits that they can have.
And if I'm under a doctor's care and I'm on medication, that doesn't hinder me from being part of this program. In fact, it may help.
No, it's only going to assist. And if you're using your Medicare benefit, this is not going to affect in any way anything else. Like, for example, many seniors over the age of 65 may be on home health. This is not going to hinder any of your benefits.
All right, this sounds like something, well, that's a great benefit to those who are struggling to support and take care of family members, loved ones who
Yeah.
are battling dementia. All right, Michelle Rankine, thank you so much for sharing with us about the guide model, this new no-cost support for caregivers of those suffering with dementia
Thank you
through
so much.
Medicare.
Yes, thank you.